A wonderful good day to you. This is Owen McCafferty offering another presentation on scheduling continuing education and the time that's required to just take a hard look at what you're doing, specifically in the professions of veterinary medicine, dentistry, and human dermatology. We just prepared a video on documentation and looking towards the end of the third quarter and the start of the fourth quarter as a time when you really want to think about getting organized. And now is a good time to look at getting organized for the year to come, that is the 2025 year, for continuing professional education. For example, in accounting, we have to have 40 hours a year at minimum. No one but a fool would limit their continuing education to 40 hours. There are some years when I have over 200 hours of continuing education. And the reason for it is that the accounting profession is changing unbelievably quick. And if you don't take continuing education, you're in trouble. Other professions have a de minimis amount, in my personal opinion, of continuing education. Of course, if you are focused towards a specialty or some sort of boarded activity or a designation through certification, there will be additional hours of continuing education. So for example, I'm also a certified veterinary practice manager. I'm also certified in financial forensics. I'm also a certified global management accountant. And with all of those different designations, as well as my work in valuation, there are separate requirements for continuing education. So I try to map out, so there's not duplication, what specific continuing education will be needed. And then I look at the fact that I'm licensed in 6 states, and some states have different requirements for continuing education. Now, be you a doctor of veterinary medicine or dental surgery, or a medical doctor, you're also going to have needs for continuing education. And most probably, if you're listening to this presentation, you are exceeding that continuing education. We have now the availability of the internet, and with the internet is the capacity to look at our needs, our capacities, what type of work we're doing, and then focus your continuing education upon those needs, and not just to meet the base requirements to maintain your license, but more importantly, to build a knowledge base. If you're in a profession with a body of knowledge and a code of ethics, you never stop learning. And in fact, I'll submit to you, as you age, gray, paunch, and bald, you come to the realization that you need more continuing education instead of less. So now is the time to start looking at what courses are being offered. I know that there's many courses in the medical professions towards business management, with the common hackneyed statement being made that in professional schools, you really don't get a lot of education in business management. And I think some of it is a good idea. However, you're in a profession, and the profession requires knowledge of the change. So I would strongly encourage you to focus in on your profession and take those medical and surgical courses that are needed to maintain your standing as a doctor. Remember, every time you go into a continuing education course, you're providing not only yourself, but the rest of your staff an opportunity to do more for patients. And doing more for patients expands the base of competency, and with that base of competency comes a wonderful opportunity to improve. So bifurcate what you're doing. Some of you may be saying, well, gee whiz, I want to take some coursework at a university, or maybe through an association. So for example, the Veterinary Hospital Managers Association sponsors my certification as a certified veterinary practice manager. So I'll look to them, as well as the American Institute of CPAs and the state societies that I belong to in Ohio, Kentucky, Georgia, Florida, Texas, and Nevada, and find out what type of coursework that is available. I also look for the American Society of Appraisers and what specific coursework they would have available. And I'm just using some of the examples of what I do because you may want to consider some of those things yourself. Plan now for continuing education. Life has a way of consuming your availability. So schedule in now, buy your plane tickets, stay at a nice hotel. It may be sponsored by the organization, but also look at separate pricing. If you belong and have an American Express card, as I have a few of them, because unfortunately I travel, and I live sometimes out of a suitcase, you will find that they have concierge services that will help in the scheduling and provide you with insightful opportunities to gain better lodging and recommendations for good places to eat and better options for travel. So with all of these things in place, especially in a profession where there is a continuing need for a body of knowledge that is constantly demanding attendance on your part, do the things that are needed to plan ahead. So buy your tickets, register for courses, see if you have a buddy that is attending, because sometimes having another person provides you with an opportunity for Socratic exchange after the actual coursework to solidify issues. If you're in a larger practice, you may want to bring some people with you and then have the opportunity to use the time after as a way to plan for implementation of the continuing education into your practice, providing new opportunities and care plan options for patients. So, not to belabor the point, but to encourage you to consider all of these things. This is Owen McCafferty, and I hope you have a wonderful time planning your continuing education for the 2025 years. Take care and talk to you in a bit.